80% of people will have low back pain at some point in their life. But when you have multiple sclerosis, it's common that you have weakness in various areas of your body. Maybe it's your legs, maybe it's your core, maybe it's your arms, maybe it's everything. And when you have weakness in your body, typically your low back does way more work than it needs to. And when it's doing more work, it gets stressed and it can have low back pain. And let me just say, there are so many reasons that you can have low back pain. But one common reason is that the sacroiliac joint, which you might know of as the SI joint, gets knocked out of place. Sometimes this happens just because movement is hard and your legs are hard to move forward as you're walking, so your core muscles and low back overwork and that puts stress on the SI joint. Another reason the SI joint might be knocked out of place is if you're doing any type of rotation movement, such as raking, shoveling, or even picking up a heavy box from the side, or maybe picking up a kid, picking up a laundry basket, something where you're turned over to your side and then lifting it up towards you. Today, I want to show you an exercise that you can do to strengthen your core muscles and low back muscles to reduce that SI joint pain, and it will also help get that SI joint back in place. The sacroiliac joint is where your hip bones connect to your sacrum. Your sacrum is a triangular shaped bone that is at the very bottom of your spine, and the very most bottom part of the sacrum is your tailbone. Typically, if you are having SI joint pain and someone asks you, where is your pain, you will be able to point with one finger to the dimple in your back, either on your right side or your left side. It can be both, but usually it's just one side or the other. My name is Dr. Gretchen. I am a physical therapist and a multiple sclerosis specialist at The Missing Link. And my goal is to give you a bunch of exercises you can do at home for free to help you champion your life with MS and move about your day-to-day life a little bit easier. So let's jump in. I am going to do this exercise on the floor. However, you can do this exercise on a couch or even on a bed. Make sure you choose a surface that is easy for you to get off of. If you have difficulty standing up from the ground, then I do not want you struggling after this exercise to get up. So make sure you choose a surface that is safe for you. The first thing you're going to want to do is sit with your knees bent and lay down on your back. From here, you're going to extend one leg. It doesn't matter which one. I'm going to do the one closest to you, which is my left leg. So my left leg straightens and my right leg stays bent, and I'm going to use my hands and clasp them and put them around my knee. From here, I'm going to push my knee away in this direction, but my arms aren't going to let it move. So it's this push-pull movement. So you hold here and push. Hold, 5, 4, 3, 2, 1, relax. You should see very little movement during this exercise. Push again, 5, 4, 3, 2, 1, relax. You want to do this about 5 to 10 times on each side with a 5-second hold every time. Let's do it one more time. 5, 4, 3, 2, 1, relax. Then slowly put this leg down and you will do the same thing on the other leg. If you have difficulty reaching your leg, you can use something like a bathrobe belt. It should not be stretchy. It should be nice and taut so that you actually have resistance to push against. I'll show you what that would look like. So you have your belt and you're going to throw it around your leg, bring it up towards you. I like to put both of the ends together and hold with both of my fists in the same spot. Otherwise, it's the same movement. You're going to push your leg away from you, but your arms hold tight so your leg doesn't actually move. So push for 5, 4, 3, 2, 1, relax. Push again. 5, 4, 3, 2, 1, relax. We'll do it one more time, so I did 3 on the other side. Push again, 5, 4, 3, 2, 1, and relax. The second exercise that you want to do after this one is pretty similar. It is still a push and pull movement, except instead of your hands being here, your hands are going to be on the opposite side of your leg. So it's going to be on the front of your thigh, and your leg is going to be coming towards you, but your hands don't let it move. So you want your elbows to be extended and your hands to be on your leg. Then you're going to push your leg towards you. Hold. 5, 4, 3, 2, 1, relax. Push again. 5, 4, 3, 2, 1, relax. We'll do one more. 5, 4, 3, 2, 1, relax. Same thing on the other side. Bend your other knee, straighten your left. Arms are straight. Push. 5, 4, 3, 2, 1, relax. 5, 4, 3, 2, 1, relax. One more time. If you're doing this for real because of back pain, then I would generally suggest doing between 5 and 10. Push one last time. 5, 4, 3, 2, 1, relax. One thing that you'll see is I am flexing my calf, which is not required. You could leave it down and floppy, but by flexing your calf, it saves your ankle and your knee joint a little bit. So I have a personal preference to do that. These movements should not be painful. And one great thing about this exercise is that you are in control of how much strength you push and pull with. You should not be pushing and pulling against yourself with 100% strength. I generally suggest really starting with only 25% of your strength. So it's just this light pushing and pull movement. If that feels okay, maybe go to 50% or 75%, but it should be comfortable, there should be no pain anywhere, and you should feel your back muscles working a bit. If doing these exercises lying down is too challenging, you can do them in a seated position. When you're doing this exercise in a seated position, it's the same movement. So for the first one, you're still going to grab your hands like this, link your fingers together, and you're going to slightly lift your leg and hold your leg here. From here, push your leg as if it's going down towards the ground, but your arms don't let it move. 5, 4, 3, 2, 1, relax. Another grip that you could do is still have your hands linked, but instead of having them around your knee, you can have them under your knee. Same thing, push your leg down towards the ground. 5, 4, 3, 2, 1, and relax. And you would do the same thing for an equal number of repetitions on your other leg. The second variation that I showed you down on the ground can also be done in a seated position. Your hands are going to be stacked on top of one another, right on top of your thigh, and your leg is going to do this lifting movement, but your hands don't let it move. So go ahead and try to lift, hold. 5, 4, 3, 2, 1, and relax. I actually find this variation more challenging in a seated position because you're lifting your leg up against gravity, but it can be done. And as always, you'd want to do the same number of repetitions on the opposite leg. For some people who have true SI joint pain, doing these exercises for a couple of days in a row can make a huge difference. For other people, you might have to do these exercises for a couple of weeks before you start really noticing a big improvement. I hope you enjoyed this video and learned a lot. And if you're interested in learning more about the Missing Link, my online MS Wellness program, click the link in the comment section below, where you will find a behind-the-scenes video that will give you all of the details. And if you enjoyed this video, please remember to press the thumbs up button, share with a friend, and press subscribe. And if you have a couple extra minutes, here are some other videos that you might enjoy.